World Malaria Day is observed annually on 25th April to bring global attention to the efforts being made to end malaria and bring about change to eradicate malaria completely. The WHO has noted impressive gains by India in the fight against malaria. According to its report, most malaria prevention campaigns were able to move forward this year without any delays in spite of the COVID-19 pandemic. India recorded the largest reduction in malaria cases in Southeast Asia from 2000 to 2019. India has contributed to the largest drop in cases nationwide from 20 million to 6 million. In spite of the outstanding achievement by India in cases of malaria, strict intervention is needed to eradicate it completely from India to zero cases. At Medicircle, we're conducting a series on malaria with eminent doctors for World Malaria Day to boost awareness and educate people about the preventions from it. Hi, this is Sana Khan, and today in this initiative, we're going to speak to Dr. Dhrumil Panchal. Dr. Dhrumil is an experienced, skilled, and awarded doctor in his field of specialization. He's a well-known doctor based in Mumbai who specializes in the field of medicine, with special clinical expertise in treating patients successfully. He has over 7 years of experience practicing medicine in various hospitals and clinics. He is currently associated with Dr. Dhrumil's Clinic and Diagnostics. He specializes in skin allergies, allergy treatment, viral fever treatment, insulin-free treatment, diabetes management, irritable bowel syndrome treatment, and so on. Beyond affiliation with many hospitals, Dr. Dhrumil has been professionally active in many other ways too. Hello, Dr. Dhrumil. Welcome to Medicircle. How are you?
Hello, I'm doing good.
Okay, Dr. Dhrumil, how one can get malaria and how is it transmitted?
Malaria, as everyone knows, the only cause for that is by insect bite. Okay.
True.
The other ways also, but it's a very rare, like blood transfusion, other thing also causes malaria. So we can call it as 0.01% chances for that.
Right.
Mainly it is due to the mosquito, and people should take prevention during the dusk and dawn.
Okay.
The malaria mosquitoes, especially they bite during the sunset time and the sunrise time. That should be avoided a lot.
Okay. So doctor, what are the signs and symptoms of it?
The main signs and symptoms which we can look for is the fever, as everyone knows. The fever with shaky chills is the most common symptom we can see in all the patients. And it will be intermittent, like we can say the fever will be on and off. And it will be the same time every day. Fever will be associated very high, above 100, 101. Patient will be having too much of shivering associated with sweats. And patient will complain of other symptoms like body ache, muscle ache, too much of weakness, tiredness, and headache will be usually there in all the patients. Okay, those are the symptoms. Then we see and we check for the malaria parasite test.
Okay. So doctor, what precautions are necessary to prevent this?
Only precaution we can take to avoid getting a mosquito bite. Yes.
Yes.
Avoid getting the mosquito bite as much as possible. Use mosquito repellents.
Okay.
Use Odomos. You can use the drops which can prevent you from the mosquito bites.
Right.
And using nets, closing your windows during your evening and the morning time. And if you have any symptoms, visit to the doctor. They can evaluate and start the treatment early. If treated early, malaria is not fatal. But if it is delayed, then it is a very, very dangerous disease. It can get many complications.
Okay. So, doctor, what is the treatment procedure in this?
Yes, malaria, luckily we have the treatment. Okay. It's not like dengue, like we need to get a supportive treatment and wait and watch.
Right.
So initially we start with the medicines for that. Okay. Nowadays, depending upon the which type of malaria, like there are 4 types of malaria, Vivax and the falciparum being the dominant ones.
Okay.
We treat with them with the artemether and the lumefantrine, and we can start with the IV injections also, artesunate over there.
Okay.
Okay. And it depends which treatment need to be done, saying the platelet count, CBC, the index of the malaria, whether to treat the patient at home or they need to be admitted. But some countries, like in foreign, like in US, we have seen all the patients with P. falciparum. Okay, so type of a malaria, which is the deadliest one. The patient has to get admitted in the hospital, and they treat the patient over there to avoid with the complications. But over here, all the patients are treated at home due to our good immunity. Even the falciparum infections are treated at home itself.
Oh, okay.
Okay, so my only advice to the patient will be, if you have any symptoms of fever, visit to the doctor. They will evaluate and do your test. And then if you are malaria positive, there is nothing to worry. Be given medicines and you will be told to do the blood test like CBC every 2 days to evaluate the platelet count and the RBC count.
Right.
Depending on that, the treatment can be done later also.
So an early diagnosis is very important, I think.
Yes, yes, that's very important.
Okay. Thank you so much, Dr. Dhrumil, for your time and your insights with us at Medicircle. It was a pleasure having you on the show.
Thank you.
Thank you so much.